Hello everyone, my name is Ernesto and my clinical practice is in motility and neurogastroenterology at the University of Pennsylvania in Philadelphia, Pennsylvania.
Hi everyone, my name is Saurabh Chandan and I'm an advanced endoscopist at Methodist Hospital West in Houston, Texas.
On behalf of our co-authors, we'd like to thank Gastrointestinal Endoscopy Journal for giving us the opportunity to talk about our recent published article titled Clinical Impacts on Routine Esophagogram After Peroral Endoscopy Myotomy, a Systemic Review and Meta-Analysis. Routine esophagram after point has been part of our post-procedure care for years, largely out of caution rather than evidence. Yet despite of how often it's done, we've never had a comprehensive answer for whether it's actually changed outcomes of our practices. In this study, we reviewed data for over 2,000 patients across 14 studies to evaluate the true clinical value of this practice. What we found challenged long-standing assumptions and raises important questions about how we streamline care, reduce unnecessary testing, and still maintain the higher levels of safety.
So keeping that in mind, we conducted this systematic review and meta-analysis in accordance with the PRISMA guidelines, and a comprehensive literature search was performed in various databases through November 1st, 2024, assessing the outcomes of routine esophagram after esophageal POEM procedures. Our inclusion criteria were studies reporting on adult patients who underwent POEM with an esophagram performed within 24 to 72 hours after the procedure as part of the routine post-operative care, irrespective of patient symptoms. Studies reporting quantitative data on esophageal leakage and/or perforation, and those studies which provided information on whether the imaging findings resulted in a change in clinical management were included. Our exclusion criteria were case reports, editorials, reviews, or studies lacking a full text, as well as those studies where post-POEM imaging was performed for symptomatic patients only, and finally studies performed in the pediatric population, as well as those that were not published in English. Our primary outcome was to assess the pooled rate of esophageal leakage identified on routine imaging after the POEM procedure. Esophageal leakage was defined as intramural if the contrast was contained within the esophageal wall, or extramural if there was contrast extravasation beyond the esophageal wall. A radiographic result was defined as incidental if the finding was identified on routine imaging in an otherwise asymptomatic patient. Our secondary outcomes included the pool rates of all types of radiographic findings and those of which resulted in changes in clinical management. Any intervention, such as dietary change, antibiotic therapy, repeat endoscopy, surgery, or prolonged hospitalization that ensued based on routine imaging results was defined as a radiographic finding that led to change in clinical management. Pool proportions and 95% confidence intervals were calculated using a random effects model to account for inter-study variability, and we assessed heterogeneity between study-specific estimates by using the Cochrane Q statistical test for heterogeneity, as well as 95% confidence intervals and the I-square statistics.
Based on this, our meta-analysis, we evaluated about over 2,000 patients who underwent post-point routine imaging across the 14 studies, as mentioned before, to answer a simple but important question: does routine esophagogram after point actually change care? And here's what we found. First, esophageal leaks were rare across all the studies. The pool rate of intramural leaks was just 2.3%, and extramural leaks only 1.4%. But the key insight is not that how low these numbers are, is who actually benefit from the imaging. Nearly all clinical meaningful leaks were in patients who were already symptomatic. Only 3 asymptomatic leaks were ever picked by routine imaging alone across the entire dataset. Second, routine imaging generated a large number of findings such as pneumoperitoneus, pneumomediastinum, even a small pneumothoraces, which were largely represented from one study which used air insufflation, but more than 95% of these findings did not require any intervention. Pneumoperitoneum occurred in 42% of the patients, pneumomediastinum in 30% of the patients, yet almost none changed management. And third, we look at what actually made endoscopic as the pool rate of routine imaging findings that resulted in any change in care, diet changes, antibiotics, prolonged stays, or endoscopic or surgical intervention. It was only 3.4%.
So in conclusion, this comprehensive analysis supports the safety profile of esophageal POEM and demonstrates that esophageal leakage is a rare adverse event. Routine esophagram rarely impacted immediate post-procedural clinical care in otherwise asymptomatic patients. Selective imaging in patients with suspected adverse events based on other clinical indicators may result in a higher diagnostic yield, improved cost efficiency, and mitigate the burden of unnecessary testing due to incidental radiological findings after esophageal POEM. We thank you all for taking the time to watch this author interview for GIE Journal and hope you enjoy reading our article. Thank you.
Thank you all.